And when we talk about responses like grief, like stress, like heartbreak and exhaustion, in your opinion, right now, are these over-pathologized?
Yes, they are absolutely over-pathologized. We have set up a system where the only way that you can get help is if you have symptoms. We don't have a middle ground where you can do something outside of therapy.
How do you reconcile that with the idea of, hold on a second, there's work to be done?
Life is very difficult. We have culturally not allowed room for pain as acceptable.
Do you feel that is also the case with something like autism?
An immature, emotional parent will look at their child as an extension of themselves and will need that child to behave in very specific ways because
Alison, sometimes it happens that people come on this podcast and they are in a field that I'm super interested in, like yourself. And there's 1,000 questions I can think of right now that I want to throw at you all at the same time. And it's very hard to figure out where to start. But let's just start with you. Let's just start with your story. Can you tell me who Alison is and what you do for a living?
So I am a clinical psychologist by training. So I have my doctorate and I focused on anxiety disorders primarily. And I worked in a variety of different contexts. So I was in the prison system, helping especially, well, across the board, people who were new into the prison system and then people who were just about to leave and to kind of re-enter the world. And then I've also worked in college counseling situations, and believe it or not, they have more in common than you might imagine. Oh, I lost an earbud. I find that when my mouth moves, my ears move, and so the AirPods. So I have worked in the prison system and college counseling, and then I worked in community mental health. So that was where I really focused on how are people living their lives and when do they ask for help. Then for lots of life reasons, I moved into user experience design and research and worked for a number of software companies, usually running the design teams and starting the user experience research programs, angling mostly in the healthcare space. So for a number of years, I worked for a therapy platform called, in America, it's called Sondermind. And they are really focused on trying to match the right person to the right therapist. So they were working on an algorithm to make sure that you could find someone who actually could help you for myriad reasons. And so I was doing a fair bit of research to help understand why people were looking for help. And what I realized in both my training and at Sondermind was that there's a big swath of people who are engaging in the therapy community or looking for therapy who don't actually meet clinical criteria, who don't have a diagnosis, who are going through a life challenge and they need additional support, but they don't rise symptomatically or however long they're going to be going through this process to needing the depth of what you can get from a therapist. And so we have set up this system where the only way that you can get help is if you have symptoms because of the way that therapists are paid through our insurance system.
Mm-hmm.
You have to have a diagnosis. And so we have this sort of low-level entry diagnosis called an adjustment disorder. And an adjustment disorder is basically you've run into a life encounter, something is challenging your life, say a divorce, a move, something like that, and you're not adjusting well. And that's what we use to give the majority of people who come into the healthcare system looking for mental support, we give them that diagnosis. So when you go and you look at the statistics about the number of people who have depression or anxiety, and then you dig into their actual stories, there's a huge number of them who may have some symptoms of those, but wouldn't actually meet clinical criteria. But we don't have a way for them to get help. We don't have a middle ground where you can do something outside of therapy. There's coaching. Um, Coaching, again, is really focused on sort of goals and change and optimization. And the focus there is sort of an engagement to get you to a new place. It's not really about helping you through your divorce. No coach is saying I'm a
Right. Yeah.
divorce
Yeah.
coach, right? I'm
Yeah.
a lawyer.
Hmm.
And so where I found this problem, and I saw it when I was in community and mental health too, is that I, as a therapist, was put in a position of needing to tell the insurance company that this person was perhaps worse than they were. And then when they started to get better, they would potentially lose access because they were no longer clinically relevant to an insurance company because they are focused on the medical remediation of symptoms. And I was focused on making sure this person had what they needed to move back into their life. And sometimes that was more than 3 to 5 sessions. And so I felt like once I reached a certain point in my life where I could start a business, that filling that gap and being able to come up with a way to support people, maybe they are in therapy, but that's not something that they always have access to, or maybe there's something that happened at work and they don't necessarily want to go and talk to their therapist about it, or maybe there are just people who are in a life transition and they feel like it's not big enough for therapy. I think we're in graduation season, so there's a lot of people who are leaving college, and college is where you have lots of sort of supports. You have institutional supports,
Hmm.
college counseling, your friends, and then you go out into the world and you don't have access to those things. You're job hunting. Maybe you had to go back home and live with your parents, which is now a new dynamic because you're an adult and yet you're in your parents' house, and so now you're treated like a child. Those are all things that are difficult, but we don't have a way for you to get help outside of your friend group. Or you can go talk to a therapist, but you probably will have to have a diagnosis. You'll have to talk about the things that your sleep and the anxiety, and maybe those are things that you need help with, but probably you have the coping ability. It's just that what you need is additional support. And so I just feel like our incentives are wrong. We're spending a lot of energy in a limited resource where there are not enough therapists. Those therapists are not always practicing at the top of their license, doing the most critical work. Um, and so we've just got this big gap in how to best support people that I really feel like is patently obvious if you've come from my background. Um, and something that I'm trying to really spread the word about is that there is emotional support for most people going through life transitions. It just needs to be available.
Yeah, and let's talk about that line between having an issue, an emotional or a mental issue, and actually needing to be diagnosed. Because I've been looking into your work, and you seem to argue that modern culture is way too quick to label an emotion or an emotional state as pathology. And when we talk about responses like grief, like stress, like heartbreak, and exhaustion, in your opinion, right now, are these over pathologized?
Yes, they are absolutely over pathologized. We, I think, have a couple of inputs why that's true. One, I've already discussed the fact that our um, incentives about how we get paid on, either that the insurance company is willing to pay the service and the person who's giving you the diagnosis is getting paid. We are
Yeah.
incentivized to make them pathologized. That's on one side. The other is that culturally, I think we went through this idea that you need to be happy, that is the goal of life, is to
Mm.
optimize happiness. And
Mhm.
so we have all of this conversation about, thinking on the bright side, and when terrible things happen, being resilient. And we just have not allowed room for what is true of human and being human, which is that we have the full spectrum of all emotions. And life is very difficult. It can be joyous, but if we are at a place where we believe that grief is something that you have to go to a therapist to talk through versus being able and willing to experience the pain. I just feel like we have culturally not allowed room for pain as acceptable. We will channel it to anger. We will channel it to sort of physical pain, where we'll go and work it out. And we'll talk about how that kind of pain is the kind of growth that you want. And so we've got these sort of limited channels. But I really feel like we've shut down the opportunity to feel all of our feelings. They're just unacceptable. You can cry at the funeral, but not after. You can cry alone, but not in public. We've just really said that to be fully actualized is not to actually be able to feel all of your feelings, but to only feel the positive ones. And I think that that has really stunted us in our ability to connect with other people and offer the kind of community support that is what historically has gotten people through life before we had all of these sort of medical ways of addressing the life challenges. Also, life is more difficult in some respects than it used to be. Making a living is quite challenging in an environment where you could get laid off at any point. We have very little security. And so the precariousness of kind of living life, particularly in America right now, I think is a level of stress that is just something that we all have to incorporate, but wasn't maybe originally how we were supposed to live in the world. And without the commonalities of being able to talk about that and talk about the stress and what that's doing to us, if we have to ignore it and just go to work, then I think that that is a kind of a head trip where we are sort of gaslighting ourselves into thinking it's only hard for me and I'm the problem. And then internalizing that and wondering, why am I the only one who can't be happy because social media says everybody's on vacation and they're beautiful and happy and look at their performing children. And so I just feel like we have not made room for the fullness of experience, and we don't have the language for it. We don't know what to do. People are terribly awkward. We don't have the language. I think when someone is going through a difficult time and you want to text them, and we don't have any cultural scripts. When I think about my Jewish friends, for instance, they have when someone passes away, and the phrase that they use is "May their memory be a blessing," and it's just a lovely known phrase that you get to say, and it's not awkward. And in that community, they know exactly what you mean. And so if you don't have those cultural scripts when people are going through difficult times, people freeze and then they feel abandoned. And so I just feel like it's a real cultural challenge and structural challenge to be human today.
Do you think there's a difference between men and women in that regard when it comes to the expectation of dealing with their negative feelings? And I will tell you why I'm asking this. So there's a couple of loose hanging thoughts that came forward while you were telling this story. And let me know what you think about this. Because one of the things, you mentioned, for example, funerals. One of the things that, I'm not sure if it's an expectation, but one of the things that I approach as an event like that with is, yes, if somebody passes away that's very near and dear to my heart, 100%, I'm going to be sad about that. I'm going to be very upset about that. But at the same time, I'm not going to be that upset to prevent myself from helping others through it. So actually, this happened a couple of years ago, and that's a perfect example. Somebody very close to us passed away, and my wife, my partner, she was incredibly upset about that. If I would share in that upsetness, let's say, then you could make the argument like I emotionally connect and I am on the same level as her, and there's an understanding that can be found there. But at the same time, me as a personality, in my personality, I didn't do that. I of course understood where, she was very close to her, so I understood where it came from. But the point I'm trying to make here is, what I had in mind is I have to keep myself on the ground. I have to keep myself okay. Because if I sink into that mud as well, there's no way I can take care of the people around me that are suffering greatly. So there is a well, that's a sense of responsibility, I suppose, but it's also a sense of I don't want to make the emotion for other people worse, right? Because it doesn't help them in any way. So my question to you now, and I'm realizing this is a very vague question, but my question to you is, how do you reconcile what you just said, like taking not just that day for being sad, but also allowing yourself time to process it afterwards? How do you reconcile that with the idea of, hold on a second, there's work to be done, right? There's a fight to be fought here. We need to be strong at this moment. We can't sink down, because else the misery is far greater than what it is right now. How do you bring these two together?
Yeah, I think there are two thoughts that come to mind as you were talking. One is the feeling, and the other is the expression of the feeling. And the behavior is separate from the emotion. So keep in mind that just because I'm not crying doesn't mean I'm not feeling very, very deeply.
Right.
So I think it's common to think about the expression of the emotion as a reflection of the depth of it. And I would challenge that you can be feeling very deeply and still be able to function. The other piece, I think, is that you said a couple of times this idea that we would sink down and not be able to get back up.
Mhm.
And that I challenge also is that I think there is this idea that if we give in to our emotions and we allow the depth of feeling to fully come through, that we lose our ability to function. And I was raised this way as well. That was absolutely true in my family. What I have found to be true in my own experience and in practice is that the amount of energy it takes to hold the expression of that emotion back is actually more than what it takes to feel it deeply and then let it resolve.
Mm.
So there is a process of allowing it to flow through, which is actually much faster than the I feel it and I have to stop it so that I can function. And so if you haven't experienced this idea of letting it take you over and then push through, it feels like that level of intensity and not being able to focus on anything but crying will go on too long. But what is actually true most of the time, because I remember very much saying this to my therapist of, if I start crying now, I'm not going to stop. And he said, how do you know that? You haven't started crying.
Good question.
And it was really important that I allow myself to experience it. And honestly, I cried intensely for about 3 minutes. It didn't get in the way. It didn't put you into the mire. What tends to is the pushing off of it. And so you can be quite strong in both allowing the emotion to be there and then being able to have it move through and then focus on other people and what they need. But the process of eroding that and saying, I can't do that now, I'll have to do it later, takes up an enormous amount of energy. And so you find that when you're through with the point where you're like, okay, everybody else is taken care of, now I can feel, you're so tired that it can actually be quite difficult to get back to that original connection with
Mm.
those feelings. And so I would counter to say that it is worth experimenting with letting the feeling rise to its intensity and fall, because it's a much shorter time frame than I think we expected, especially if we've been given messages growing up that to feel that level of intensity is to relinquish our control. And I think that that is a myth.
Mhm.
I think it is a myth born of fear of true, strong emotion.
Right. So, to be absolutely sure, the argument that you're making here is in the case of a horrible travesty happening, if you allow yourself to feel that emotion and to deal with it straight away, that doesn't mean it's less painful, but it allows you to to recover from it quicker. Yet if you take that position where you are like, okay, there's a fight to be fought right now, we're going to do what is needed, that doesn't mean you feel less. It means you, I suppose, reprioritize where you spend your energy. And right now you prioritize taking action to help those around you, and then to later recover. But at the same time, the argument that you're making, which kind of makes sense, and I think this also is about things like trauma, because, okay, let me finish that thought first. It kind of makes sense because what you're saying is, the longer you put that path to recovery off, the deeper it gets buried under the new experiences that time give you. So don't take too long. And the reason why I said it kind of makes sense is because I guess this is the same, and correct me if I'm wrong, but I guess this is the same thing as when you have things like a childhood trauma or something like that are very far into the past. Well, you have 20, 30, 40 years of experience that have been thrown over that experience. So you've allowed that to linger for a very long time. So you have to dig way deeper in a metaphorical sense in order to uncover that and to give it a proper place. I think that's what you're saying, right?
Yes, very much. And we are rewarded for not expressing our emotions, and we're rewarded for being available to others in times of crisis. And I'm not saying that you shouldn't be, but the messages that we generally get are that to be of service and to be effective is laudable. And so it can then, but nobody is saying, hey, I need to make sure that you are also breaking down. I need to make sure that you are allowing the storm to burn out and that you haven't just put it into a spot that it's gonna get buried. And without that secondary message that you need to actually feel all of the feelings, to your point exactly, they will eventually come out. They'll just come out sort of sideways.
Mm-hmm.
It'll come out in a physical way. It'll come out as anger when it's really grief. It's not that it won't come out, but it won't come out in a way that you find healing. It'll come out in a way that you now have to also manage the consequences. The phrase that I was taught was there's clean pain, which is sort of the initial loss. So imagine I lost my sister to cancer when she was 40. The loss of her is devastating and very intense. But then there's dirty pain, and that's everything that you put on top of the original pain. So that could be sort of guilt or denial, or she shouldn't have, and there's a problem with the insurance company, and she might still be alive today if they'd approved a particular drug, which is possibly true. But telling myself those things is adding to the original pain. And so sometimes you have to dig down through all of those layers of dirty pain to actually be able to just experience the clean pain of loss, which sometimes we find it much easier to deal with the things that we've layered on the outside. We have emotions that we consider to be more permissible. So for men, often it's anger. Anger is an acceptable feeling to have. Embarrassment is not an acceptable feeling to have. And so we will just transfer the embarrassment into anger. And I remember my son, when he was little, explaining this to him, of like, I think right now what you're feeling is embarrassed. And as he's stomping and quite angry after making a mistake, and trying to help clarify that all the feelings are allowed. But we have some that we are more comfortable with. Anger in my family was absolutely not acceptable, especially for a woman. And so even now, I find it to be something that I will turn into something else. And I won't allow that original pain of anger to stay there very long. And so being able to recognize it, feel it, let it pass through is my work, and is the work that I want to help other people with. But it's more likely that what we end up doing is piling other things on top of it.
Let me ask you a personal question. Because I'm really curious about what you just said. I'm the kind of person that if a travesty happens, I try to be the guy that helps people through that travesty. And just as in the example I just gave you, what I try not to do, at least, I try to do it as little as possible, is express whatever it is that is going on in terms of anger. Well, certainly anger. Anger is not something that I suppress to people in general in any way, especially not if those people have nothing to do with it, right? Because in my mind, if something terrible is happening to me and I'm going to work and there's a colleague at work that does something wrong and just ticks me off or something like that, and then I get angry at that person who has nothing to do with that, that doesn't make any sense. So I do whatever I can to prevent it from happening. What I'm going for is, I have my wife, so obviously when there's stuff happening, I have conversations with her, and she's a great talker. So that's a really beautiful trait to have. So we discuss a lot, but that's the I think the only person I share those experiences with, and with no one else. And again, if those experiences hit both of us, like that example, she is not the person I'm going to bother at that moment. I'm going to deal with it. What is something that people with this specific way of thinking, the kind the men that want to be, for example, strong for the people around them, and that want to take responsibility and to help everybody around them through a crisis, what should those men be very aware of? So what is, for example, a thing that I need to be aware of in that story that I just gave you? What might be a problem there?
Yeah, I think it is an important role, and to understand the role that you play in supporting other people, it is important to recognize that that is important. I think the danger is in twofold.
Mm-hmm.
One is that you may be assuming that they need your stoicism and your control more than they do. So there is a danger there that you are
Right.
making assumptions about what someone else needs from you, and that they need you to be able to make phone calls or drive or whatever, and not sit with them and cry. And so I think that there is, for men who feel the need to help someone through a crisis, that checking to make sure that their way of helping is actually the desired path. Because like you, I can absolutely go say numb in a crisis where I am able to function. A car crash, someone died, I'm there. I can absolutely function. That might not actually be necessary. And so that's one of those things that you have to check on. Is your impulse the right way to help? Secondly, by defining your role as the person who's helping somebody else because they're overwhelmed with their emotions, there is a subtle judgment there that that person is incapacitated and I'm not.
Yeah.
And that is sort of permission that you've given yourself to not have to be like them. And that is a subtle trap. It doesn't feel in the moment like you're judging them, but it is very possible that that is what is communicated. That the way to get through a crisis is to shut your emotions down, be practical. Yeah, I'll help you because you're not able to do that. So the judgment inherent in that, by not being someone who can sit with the feelings with the person, is, I think, an unrecognized, and probably to your point, gender role. But having been socialized, it sounds like very similarly to you. This was a new realization that I had. A friend, I've had a lot of death in my life in the last like 3 years. And so a friend lost her husband to cancer in a year ago. And she didn't need me to bring her meals and to help her with the cremation and all of that. Like, she didn't need my practical help. She was fully capable. What she needed from me was to sit and hold her pain with her. And she was capable enough to tell me. I just need you to sit here and cry with me. Terrifying, absolutely terrifying for me. Not how I want to help at all. Um, but that's what she needed, and she was able to tell me that's what she needed. And so in order to get through the crisis, we had to feel our feelings, and then he was able in that it was 20 minutes. This was not a long period of time. This was not days of crying. This was 20 minutes of intense connection. And did I want to do that? I did not. Did I? Absolutely. Because that's what she asked for me. And is there permission? Are the people in your lives able to tell you, I don't want you to be strong. I don't want you to show up in the way that's comfortable for you. This is what I actually need from you.
I love this conversation with you because you brought something forward that was instantly a reflection. And I realized at the moment you spoke the words that there is indeed a judgment hidden in that action of trying to help out. And even though that is not the intention, for very obvious reasons, I can definitely see how that is the result. Let me ask you, so let me flesh this out a little bit more. Because you mentioned, don't make an assumption and instead try to give the person what they really need instead of assuming what they need. What is a good way to check what people need? And the reason why I'm asking that is because I can imagine that if people are in the middle of a crisis, they might not know themselves what they need. So how do you check that properly?
There's usually kind of a basic formula that we use. First, safety. Always make sure that the safety is taken care of. So in a crisis, when someone is in a space and they're not safe, so car crash, I need in that place to make sure that we have covered safety. And in that time, it is entirely appropriate to sort of go numb and make sure that we are coming into action for safety. And it could be the same thing when there's a death. Like, is everybody taken care of physically and there is no safety issue? So if that's not on the table, and now we are in a place where there are tasks to be done and things that maybe need to be resolved. Now I've got a little more leeway where I need to figure out what it is that the person needs from me. And asking directly might not be the appropriate thing. But what you can do is give options. You can say, I can sit here with you and we can talk about this, or I can just hold you. Or I can go and take care of X and Y. Do you want me to clean your kitchen, or do you want me to hold your hand? And so you aren't asking them to come up with what it is. You're saying what you're willing to do. And so outside of anything that's safety related, now you're saying what you're willing to show up to do and not making the assumption and not putting it back on them. So when working with my friend and saying, I want to be here with you, what are the ways in which I can show up? And she was able to educate me what she needed. And so now I've learned that I can show up in a physical way and an emotional way. And so by giving those options, you give the person the opportunity to pick. And that takes the sort of cognitive load off of them. And in fact, may not even, you may even give them something that they didn't realize they wanted. And that, I think, is where you are taking the ultimate responsibility without making the assumption.
Okay. Bring it back to labeling emotion. And I as a pathology, and let's take this a step further, because I can also ask you, for example, about something like autism. And you already mentioned that there is a kind of a weird incentive to label people, to diagnose people, so they can get therapy and they can become part of the of that system and become, I don't know if profitable is the appropriate word here, but that's the word I'm going to use. Do you feel so? Okay, so you already outlined that you feel that there is definitely over-labeling happening. Let's bring it to autism. Do you feel that is also the case with something like autism?
It's really interesting that you say that. Yes, because of the pathological element of it, not the labeling of it. So my son has autism, and one of the ways that it was important that he understand why the world is not set up for a brain like his. So to give him an explanation, to help him understand that there's absolutely nothing wrong with him. So from a pathological standpoint, I refuse to tell you that there's anything wrong with my child. He is fully capable of living a rich life. But then the world as it's currently set up, having a description that helps him understand why he reacts to the world in the way that he does, why he needs particular things that maybe other people don't need, is actually very helpful. It helps him to understand things that might work better for him because he can go and find resources that or research that has been done on people whose brains are built like his brains. And so he can use it as a means to narrow down someone's life experience who is also like him, has this sort of cluster of experiences or cluster of symptoms, and be able to get more help that way. I feel the same way about any other kind of personality description. So, I think that if you think of yourself as an extrovert or an introvert, those aren't necessarily true about you, but they are ways in which you can go and understand your needs and how you express yourself in the world. And so with autism in particular, I feel like the label is a way to help that community find each other and describe what they need in a somewhat linear way. And the pathology piece, this was always interesting to me. So Massimo never had a lot of physical ailments. Like the medical community didn't really need to engage with us. He had some ear infections, but otherwise there wasn't a lot of physical interventions that we could do. He had a language delay and a expressive and well, it took him a long time to learn to speak, and comprehension is a bit slower. So just in terms of sort of learning disability, it shows up more in education than it shows up in the medical community. And so being able to describe how his brain processes language without necessarily saying that that is a problem, it just meant that we needed to find ways to be creative to help him figure out how to exist in this world. And so I feel like, these glasses that I wear are because my eyes do not function in a way that on their own, I need some adaptive help. But does this make me less of a person because my eyes don't work that well? Absolutely not. It's just that we figure out by describing that I have an astigmatism and I can't see distance terribly well, that that description, that label helps me then to go and get the resources and the help that I need. And I feel the same way specifically with autism, is that it is a description and a label that helps to get the specific help that they need. But it's also a community and a way of understanding how the brain works and processes that we should also be thinking about the ways in which we can harness. My son has an unbelievable memory, specifically for places and details in maps. When he was very little, 3 or 4, and he wasn't speaking particularly clearly or well, he still was able to tell me the exit number for the particular we would take this exit to go to his preschool. And so he would tell me what the exit number was. And since then, he has memorized whole cities that he's never been to because that is really enjoyable for him. It's something that I guess it gives him dopamine. But being able to harness those particular talents seems to me something that would be the opposite of pathologizing. Like, why are we not taking a look at this community and saying, what is it about them and the way that their brains operate that we are lacking, that I don't have, and my brain doesn't operate in that way? How do I best harness that? And so the stim that he does in order to soothe his nervous system doesn't It doesn't matter. It doesn't do anything to harm anyone. It's simply an external way to soothe his system. I don't need that. My system can regulate a little bit more without that external input. But if that's what we use to other him, and we don't think about the ways in which he is bringing benefit to our culture, then I think the pathologizing and the labeling and the putting him into a bucket of deficiency is ultimately why the labeling plus the judgment is the problem. The label itself is relatively neutral and can actually be beneficial.
Personally, I have a big problem with this topic. And this is something that has gone through different phases. So a while back, I think around 20 years ago, you had all these different forms of autism. You had Asperger syndrome, you had attention deficit disorder, ADHD, you had a whole bunch, that, I don't know, maybe 10, 20, 30, maybe even more. Kids, children that got diagnosed with one of those very likely also got medicated for it. So they got something like Ritalin or something like Concerta, pretty heavy drugs that do a lot to a child's brain, and not in a positive way, in my personal opinion. Later on, the DSM-5, which is, and you can define it better for me. So if this is not a good definition, please tell me. But DSM-5, I believe, is just the handbook for. Is it mental disorders, or is it just psychology in general?
Yeah, it's the Diagnostic and Statistical Manual for Psychology. So it's
Right.
what we use for mental health to do our diagnoses. So, it's the fifth version, and then they'll do a text revision, and
Right.
that'll be the TR in this diagnostic Bible. And ostensibly, it's research, a reflection of the research done. And so a consolidation or a change to a diagnosis is supposed to be based on um, the 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 literature and the research. So
Yeah. Right.
the way that I was trained using the DSM is that the diagnosis is intended to drive the treatment.
Hmm.
And so if there is a great deal of overlap between two diagnoses and they don't differentiate effectively, then what is the point of calling them out in their different labels? So what was the benefit of Asperger's being separate from autism if there wasn't a diagnostic difference in the way that we would then treat them? I'll give you a very old example. I think it was the DSM-2, we had a number of, everything was schizophrenia. Just, it was a big bucket with everything was called schizophrenia. Through research, they were able to then pull out um, a variety. So bipolar was no longer a schizophrenic label, and bipolar was pulled out separately. A manic episode separate from a depressive episode pulled out separately. And so what that did was that changed the way in which they medicated, and that, to be able to then have drugs that help clarify versus sort of tamp down mania, that really did help the diagnosticians do appropriate treatment.
Mm-hmm.
Where this feels less helpful is that this is usually psychologists and psychiatrists talking to each other. And when this diagnostic Bible gets moved into mainstream or gets moved into education, that's when I begin to get troubled, because the intent of the diagnostic manual is to help drive treatment, not to necessarily describe behavior.
Right. Okay.
And so when you're in an educational setting and there's a child who is disruptive and there's a problem with the way that they engage in their environment, it is easier to use a label and to figure out if they need medication. And I will say that I do think that there is a small subset population children do well on medication. It is not, in my mind, the majority, but I do believe that there
Mm-hmm.
are those who are helped. So if there are people who are like, but my experience, yes, anecdotally and on individual case by case basis, yes, medication can be life-saving. On a population level, I am disturbed when the diagnostic labels are used outside of their original context. And education is one of those areas that I struggle with, where there is an overlap, because we are not looking necessarily at changing the education system to better work with different brains, like the Montessori system. Montessori was set up for children who had been labeled as disabled in some way, physical or mentally disabled. And
Mm-hmm.
Montessori was set up as a alternate education system because this was a group of children who weren't going to be able to go through the traditional school system. We are much less likely to do that sort of systematic change to environment than we are to use a label and then try to help that person, that child, fit into a system of our requirement. Um, and while I recognize that we can't adapt the world to every person's brain, I do think that we are remiss when we expect the change to be internal to the child and not external to the system they're operating in.
Mm. This actually answers a big question for me, because this is something that I was personally a little bit annoyed by, because my thought process here was, why did the DSM-5 decide to consolidate all those different forms into one? But that came from the perspective of seeing the differences between all those different forms. And I think the argument that you're laying out is that's not what DSM-5 is about. The DSM-5 is not about differentiating between the different forms of autism. It's about differentiating between different forms of treatment. And for those different forms, there was no different treatment. That's what you're saying, right?
Yes, that's exactly right. And so there are different expressions of the sort of cluster of symptoms,
Mm-hmm.
but it doesn't drive treatment. And so the label isn't so that you better understand who you are or your sort of set of symptoms. It's for the diagnostician and the treatment person to be able to say, this is the class and this is how we're going to
Mm-hmm.
treat you. So if we are to find later that there are genetic changes and our medicine and treatments are different based on sort of a genetic expression, then I would expect the DSM to pull them apart again, because it would be in the service of helping with the treatment goal. But we've taken the DSM way outside of its original context and used it to try to explain people and their way of operating the world. And that's a poor use of that tool.
Yeah. There's a feeling I want to share with you, just to find out what you think about it. It feels to me, and I don't have the data to back this up, that children can grow up in environments with parents that don't support them in a way that is optimal for the child. Either the child has an interest that is considered special or outside the capabilities of what the parents can provide, or there's another reason. And therefore, that child doesn't get that specific level of support, or is just not being understood. Because, for example, you have parents who have been librarians all their lives, or have worked in biology all their lives, and their child is very much interested in computers or video games or something like that. Or small animals, whatever. And is not being supported to pursue those things. Instead, is being put on a path where that child has to conform to the expectations of that parent from a very early age, but doesn't want to. I think it's fair to say that if people are forced to do something that they don't want to do, and there's no way for them to get away from that, because once again, as a 5-year-old, you can't get away from your parents because you're a 5-year-old. You're going to check out. You're not going to be challenged, not in the way that is optimal for you. And what happens then is that kid starts acting out, starts becoming rebellious or angry or sad or start throwing tantrums and all those sort of things. And it feels like parents don't recognize that dynamic going on and instead get very annoyed or even angry and start lashing out at that child and want that child to stop. Why can't you behave normal? Why can't you just be like any other child? Something along those lines. And then when that child gets out of control, what they do is they bring that child to a professional, to a psychologist or a psychiatrist, or maybe even just a regular doctor, right? If they didn't go down that path yet. And then that label comes. Then that label autism comes. And then that kid is marked for life. And that kid will get medicated. And that's where I draw a line. I don't understand that. So this is a feeling I'm having. I'm not sure if the feeling is fair. But this is right now the way I'm looking at this. And this, obviously, it doesn't go for most cases. I get that. I 100% recognize that there's definitely cases where autism is a very clear thing and medication might be the best option for going forward. I fully 100% recognize that. But I don't think that is the status quo. So when you hear this, what are the thoughts that are coming up in your mind?
A number of them. It's a scenario that I'm very familiar with. So in my training, you have to pick paths and who you want to work with. So I went to the anxiety specifically with adults, and I have other friends who chose to work with children. You are rarely working with children. You're almost always working with the parents, right? So you work with the children and help them understand and process their emotions and talk. But in order for that child to actually make any progress, you have to work within the system that they're operating in, and that's the parents. So an immature parent, an immature emotional parent, will look at their child as an extension of themselves and will need that child to behave in very specific ways because it is a reflection of the adult, and will not see the child as an individual that the parent is in service to. So that right there is one of the biggest small t traumas that almost all of us have experienced. It's endemic. And so then the child, in order to be able to continue to connect with the parent, needs to find a way to, they either ingratiate themselves with the parent, and so they forget the things that they really wanted and what were natural to them, or they do the other and they try to get that negative attention from the parent, and they act out. That is, you only have two ways as a child. The third is really just shutting down completely. And that is just I've tried everything and nothing works, and there's the shutdown. Usually it's one of the other two. You ingratiate or you lash out. That is exactly how children operate. So with most professionals, they are trained to recognize that the problem is not inherent to the child, that it is within the system that they're operating in. The exception there is when the behavior is, again, a safety concern. Are they hitting others? Are they hurting themselves?
Right.
Are there problems there that we, so it's not just sort of opposition, it's whether or not they're physically harming. Then if they're going to get a label, there should be extensive testing. So for instance, for Massimo to get the autism label, which interestingly enough, as a 20-year-old, he actually doesn't meet criteria. He only meets criteria based on his childhood expression. He's at a place in his life where, if you look at the DSM definition, he doesn't meet any of the clinical criteria anymore. But as a child, he most certainly did. And so the diagnosis there was extensive, the testing that we went through in order for that. So for it to only be based on a parent's word or specific child behavior, I think happens either you're going to somebody who is not an expert and they are somehow incentivized to give a label. So that could be somebody who is at a lower level in their training. So master's level is not necessarily able to do the diagnosis. Or you're going to somebody who doesn't specialize in that particular behavior. I know that people have gotten the label of autism somewhat, I'm going to say non-professionally. They got it from a teacher. They got it from a medical doctor who was, a general practitioner. That I would say is separate from someone who has gone through the rigor with a specialist to actually pull apart what the symptoms are and is actually focused on appropriate treatment. I think there is a whole class of practitioners who are operating outside of their area of expertise because they are focused on the parent and not necessarily focused on the child. I hope that is fewer than I have witnessed, but it is expensive and difficult to go to experts. It is not easy for every parent, and they don't have access. And so if their child is acting out, they're going to go to the person that they have resource and access to. And it would be my hope that those people would not give a label that they are not trained and capable of giving. But I've heard a lot of people say, well, I was told I was bipolar. Based on what? I've looked at your history. What? It was just because they were going through a particularly angry period and acting out, and it was a more comfortable label to say bipolar than it was to say you're angry and you don't have a way of expressing it that makes me comfortable. And so I do think that does happen, but it doesn't happen in the system as it's set up. It happens when people are operating outside of a true educated diagnostic system. And I feel the same way about the medication. If you are getting medication for a label that you are not capable of giving, you're not going to give the appropriate treatment. And so, my son has never been medicated. What would we medicate him for? Again, there isn't a specific treatment for the way that his brain works that a medication would be appropriate for. We gave him some melatonin to help him sleep when he was challenged with that. But aside from that as a specific symptom, I'm not sure what we would have done to medicate. And so if the concern is I need to change the child's behavior and I'm unwilling to engage the child directly and I'm unwilling to change the context in which they're operating, then I can see that some practitioners would choose to use medication. The only time that I can think that is valid is when there are safety concerns.
That makes perfect sense. Let me tie two things together that you just said in this conversation that are not directly connected, but I think perhaps can be. Because earlier you laid out that if someone takes the stoic position and helps their partner out in the way that they think the partner needs their help, there's an underlying assumption in there that the partner can't do it themselves. And when I asked you, how do you properly check that? How do you properly check what the right action is? You said, give them options. But in this specific story, it's the idea of if the parent does not pretty much take the trouble of connecting with their child and really seeing on a deeper level what's going on, then they would go for medication. And that child would not have an option. So I'm missing that same mechanism here. This is forcing a child to do. This is forcing a child to take something that perhaps, and maybe even likely, they can very much well live without, if the underlying problem would be addressed. It feels like fixing the symptom, not fixing the root cause. And that personally I have a problem with. I find that and again, this is a personal feeling I'm having. I don't have data. I can't say this happens in 80% of the case. Even if it happens in 5% of the case, then I'm angry about this 5%. But that I have a very big problem with. And the second thing there is, and correct me if I'm wrong, and I know that you can just speak for the American side of the story, but is there a corrective mechanism? And what I mean by that is, let's assume that that child gets diagnosed because the parent doesn't take the trouble to fix the underlying root cause, and the diagnosis is happening by a clinician or by a professional that is, for whatever reason, decides wrongly that autism is the way forward and that medication is the way forward. That means the parent has put a stamp of approval on it and the clinician has a stamp of approval on it. Is there a corrective mechanism that can stop the path that follows? Does that exist?
I think there's probably two mechanisms that I can think of. So the way that you've described this situation, and accurately so, the child doesn't have any power, right? Adults have power. Children don't have power. So where you have to intervene is in checking the power of adults to intervene with their children. You have to be careful with that, right? Because that's a slippery slope. We've certainly seen governments overstep their bounds here. It's happening with trans kids here in America. Had a Supreme Court rule that states are allowed to tell parents that they can't help their children. So this is a slippery slope in my view, but you can do some things like requiring second opinions, requiring that people who give medication to children have very specific training. You can limit the prescribing ability of certain doctors. So, for instance, if a general practitioner is giving a stimulant to a child, they would have to be required to have very specific training. That's something that you could do to put a check on the somewhat, um, I would say, casual nature of being able to get a diagnosis and get and get access to drugs for the child. So I think the system would need to recognize that there are dangers of going outside of your level of practice and saying, okay, well, if a clinician has said that this is the diagnosis, you have to have a second opinion, or if medication is the way that we're going to go, you have a limited number of people that you can go to. At least in that way, we have put a burden of proof and a level of rigor that should meet the what I'm hearing from you, or the safety concerns that we have about what we're doing to this child. And so by upping the bar, I think what you're doing is you're sort of saying, this is really important. There's a safety concern. We need to make sure that people are operating up here. And there are fewer people who can operate at that level than there are the people who can do regular medicine. And so that would be the systematic way that I would look at that. I think the other piece is that we build institutions that allow for children to have multiple options of environments. So there was an article in my local newspaper this morning about an outdoor preschool, and these children are, their classroom is outside. They are in the forest. I live in Portland, Oregon. We have lots of big parks and trees and, forests. And there is a preschool that, rain or shine, the children are outside, and they are going through trails and learning about nature while they're learning, English and ABCs and reading and spelling and all of those things that you would want them to learn. Getting that kind of program certified so that it gets funding, and it's not just, wealthy people who can send their children to these kinds of programs, where that kind of context, I mean, a child who has a high revving engine and doesn't have to sit in a seat for 4 hours in preschool is going to do so much better in an environment where they're running down the trail singing their ABCs, right? The context will change how the parents feel about the child, the kind of reports they're getting about the child behavior.
Mm-hmm.
And so if we spend our resources on giving parents multiple options, we might be able to then stem, even if they're emotionally immature, the relationship they have with the child is influenced by the other messages they're getting, the teachers who are interacting with the child, and then the parent feeling embarrassed because the teacher is telling you that your child is not behaving well. If you are in a context where the child really can't fail and the teacher is able to give praise, the parent feels good. Now we don't have to go through this dance. So those would be the two areas that I would love to see us as a society decide to put our resources.
And what do you mean by when a parent is emotionally immature? And when you figure out that is the case, how do you deal with that? So how does your approach change depending on if a parent is mature or immature on an emotional level?
An emotionally immature parent is not able to see the child as separate and independent from them. So the child is an extension of their own ego, which is somewhat dangerous for the child, because then the child needs to be able to sort of interpret from a very young age what it is that will make that parent happy. Because the parent essentially is saying, I require you as an extension of me to make me feel confident, happy, all of that. And the most, if you grow up and you're a people pleaser, you probably had a parent who gave you information that said, I need you to serve me. And maybe not literally, but certainly emotionally. And so there are people who are very good at reading the emotional facial expressions of people in a work meeting. And you will find those people who are super sensitive because their parent required that they be able to judge the particular moods of their parents in order to stay connected and keep emotionally safe. So in working with a child, an emotionally insecure or emotionally immature parent is one of the first things you need in order to be able to work with the child effectively. If you if the therapist is working with the parent, now it's a matter of helping the parent to recognize the ways in which they are trying to get their personal needs met through their children. So there's an education piece, and there is an element of helping them understand that that's not an appropriate method of getting their needs met, and it is harmful to the child. If you've got a parent in therapy who's willing to hear that, they're ready to make change. They are ready to do some healing and actually be in service to their child, which is the goal of being a parent. You are there to protect and love your child first. But emotionally immature parents are not able to do that because everything is in the service of making them feel better. So very often, those are not the parents who come into therapy. It's the children of those parents when they've grown up and they have maladaptive coping mechanisms because they're operating in the world with this trauma, small t trauma. I mean, they weren't in maybe physical danger, but they only know how to operate in the world by pleasing other people because that's what they were taught from their families. So where this shows up is often in, the child who's grown up and is trying to change their patterns. And that's when you start talking to them about how they work with their boss and what their expectations of themselves are. And they're exhausted and they're depressed. And very often it's because they're still operating under the assumption that the only way that they're going to be accepted is if they give other people what they need.
Mm-hmm. And in your personal experience, as a clinician, have you worked with adults who have that background and who were those people pleasers? And how? So, can you walk me through that? What is the process of identifying it, and then approaching it, and then probing it, or what steps do you take to bring people that are dealing with that to become more, I suppose, competent or emotionally mature. Correct me if I'm wrong, but I think that's the goal. Then, how do you handle that?
If you're working with the grown-up child who had emotionally immature parents, the grown-up child now is still operating from certain assumptions that they don't realize they have. So in every therapeutic style, all of them depend on building trust between you and your client, and building trust with somebody who didn't get to have a trusting relationship with their parent because the parent was going to withhold love and punish them whenever they did something that the parent viewed as embarrassing or not serving the parent's needs. Aligning and creating trust with that person is difficult, um, not because they aren't showing up and not because they don't want to please you, but because they want to please you. And so, as the clinician, it's super important that in the beginning of building trust, you start looking for certain patterns. What do they worry about? Um, I'll give you an example. Third session, my client, my therapist said, "Are you worried about the parking? Does the parking situation bother you? Because there's not good parking, easy parking around where my therapist building is, and so I have to like plan because it's very important that I be on time and that I not disappoint him." And so the way in which he elicited this conversation about what effort I'm putting in to not disappoint him was a way for him to just ask me a question about parking. But what that did was it opened up the conversation about my worry and what I do to control that and what I do to make sure that he doesn't feel feelings that I'm afraid of. I'm afraid of his disappointment. And so the conversation starts from parking and it ends up with me realizing how much I do to control other people not feeling feelings that I'm afraid of. And so that's the work that you try to do with your client of creating trust and then bringing awareness to those patterns that are lifelong, that you don't even realize that you're doing and that sometimes have served you. I mean, I've had some really rather difficult bosses, who I was able to, stay and employed with them because I'm able to read what they need and give it to them. That doesn't necessarily mean that I'm getting my needs, but I'm still employed. And so that is a process of awareness building and then doing some experimentation. What would it be like if you allowing the natural consequences of being late? How would we work together on allowing that
Hmm.
and sitting with those feelings that I have been unwilling to have, because they're unsafe with my parents. Um, so it's a dance of discovery and experimentation, and it can take a long time, which is the reason why rebuilding this sort of sense of self and our responsibilities to ourselves and other people is why it doesn't make sense that it's medicalized. Um, so to fundamentally change how I show up in the world and reclaim a certain amount of my own, um, I don't know, entitlement, uh, is not medical, but it would change literally every aspect of my life if I were able to continue to work with a clinician who was able to focus on that. But I don't have a set of symptoms. There's not a medical definition for people pleasing that doesn't show up as a symptom. I can backdoor that into anxiety and sleeplessness. I absolutely can find ways in which it is negatively impacting my life and my relationships. And so what you'll hear in the anxiety conversations necessarily will have a relationship side to it and a way in which we show up. But it's not what is um, going to enable me to keep seeing my therapist because that's what insurance is going to pay for.
let me ask you a question about the scope of what you do. So, Dr. Adam Ayala is a psychoanalyst who has been on this podcast 2 times, episode 7 and episode 24. And by this point, he's a very good friend of mine. Great guy. Off the air, I asked him, what is the difference between a psychologist and a psychoanalyst? And he gave me the answer. The difference is that a psychologist focuses on the symptoms and a psychoanalyst focuses on the root cause. A couple of days after that, I spoke with a psychology professor off the air, has never been on the podcast, just a friend of mine. And I asked him, okay, this is the answer that I got. What do you think about this? And he said, that sounds like something a psychoanalyst would say. So let me ask you the same question. What is the difference between a psychologist and a psychoanalyst?
I would say that the kinds of problems we're trying to solve are different. And so when the psychoanalyst is looking at the root cause, as they say, they are understanding the cause of suffering as being something that is deeply internal and born out of our childhood experiences. So their understanding of the way in which suffering occurs is old and deep and requires that kind of deep work. And I don't even disagree with that. I actually think that's probably very true. We don't get to our age of adulthood without having accumulated lots of traumas and not having gotten our needs met. Yes. The kinds of problems and the way that I conceptualize suffering is a little more immediate. And so I think that the problems that I'm trying to solve and remediate are more about quality of life and reducing the suffering in the way that people are moving through their daily life.
Mm-hmm.
And I don't think that that is inherently bad or wrong. I just think it is a different perspective. And so my conceptualization is by understanding what it is that the person themselves is telling me is getting in the way of the quality of their life. So as a clinician, I have a way of conceptualizing what's going on. I've got the diagnostic, manual to help me focus on my treatment. I can look at kind of a priority order. I always look at safety. I always look at the physical underlying problem of what's happening. Are we sleeping? How well are we eating? The body is not something to be ignored just because it's somehow, I don't know, Descartes separation between body and mind. It is important that I take the body into consideration when understanding someone's suffering. But it also means that I will stop when they're ready to stop. So if what they've needed is to say, I am suffering because I can't sleep and I don't think this is a good relationship for me, then that's going to be the scope. And as we work together, they may decide that they want to either go deeper or start looking at different patterns. But for me, the client is more in control than in a psychoanalyst style, where the psychoanalyst has a lot more of a map about how they're going to get you to the core problem of your suffering. And I feel like a psychologist is a little bit more focused on the here and now and is more client directed, where the client has a lot more say. That's been my experience between the two.
Okay.
And then with Parathera in particular, I am really focused on stabilization. So the goal there is less about change and more about recognizing that when our social networks are disrupted or the things that we've come to count on, the institutional supports that we've had, so our friends, our family, whoever we've relied on, when those are disrupted, this happened a lot during COVID, people couldn't go to the gym, and that was one of the ways in which they coped with stress. That is a type of support that is needed that doesn't really exist in a formal manner, separate from therapy, where with therapy, I do think that we are looking at patterns and focusing on change and relationships. And with paratherapy, the focus there is on stabilization. And so by offering support, validation, reflection, it's a sort of precursor in many ways to what you would get in therapy, which is also a precursor to what you would get in psychoanalysis. So if I think of it on a spectrum, that is how I'm understanding the different ways that you can engage with professionals.
Right. Let's link these two together. Okay. So part of your answer, in your answer, you said a psychoanalyst will more. You didn't use the word challenged, but that's what I got away from it. A psychoanalyst will more challenge what happened and will more guide the person, but not necessarily agree with what they're saying. They'll be just there. They'll be present. They'll be there. They're listening to the person talking, and they will guide them along the way. And you said that for a psychologist or clinical psychologist, the scope is more what the client makes it. So that if the client gets to a conclusion that is the end of the scope, then it's mission accomplished.
For now.
That is fair. For now. So from a psychologist perspective, how do you then know that the problem has been solved permanently? Because this is from a lack of knowledge. So for as far as I understand it, a psychoanalyst will go as deep as possible in order to get that root out of the earth, right? To make sure that the weed never grows again. While a psychologist will shave the weed off, but the root might still be there. It might die, but it might still be there, and it might still grow back. So if you come to a conclusion, and you already said for now, but if you come to that conclusion, what is the next step? How do you know it has been solved? Or if how do you know that the moment your client leaves the room, that whatever happens next is a good thing, a productive thing?
I think there's a couple of elements in there that are important to highlight. I do believe greatly in my client autonomy. I work with adults, and adults get to say when they feel better. And it's a subjective measure. And I probably see areas in which we could continue to work, but the client has autonomy, and this work is hard. And I can see that there are times when they are not wanting to keep going, or they want to live the life that they're living with new knowledge, with a reduced level of panic. And they want to see what life is like with the discoveries that they've already made. And so if, for instance, someone comes to me because they have a phobia and we are able to reduce the subjective suffering that happens because they aren't able to get on the plane, do I need to assume that we have to go all the way back to the reason that they created the phobia in the first place for them to feel that we've had an impact on their life? Will they come back later because they develop another phobia? Very possibly, but they will have learned in the time together that they are capable of learning new skills, applying those skills. And it is very possible that we have highlighted some things that they can do differently and they'll make different choices. But I definitely believe that it is not my determination that matters, but theirs. Client autonomy is incredibly important. And maybe they're not ready, but that's not my call.
This sounds to me like a very tough call to make. When I will be in your shoes, and I've obviously I'm not, but I can imagine that if you work with a client and you know that the client is not always clear of mind, and that the client has a tendency of not always making the best calls, that letting them to a conclusion and letting them tell you that they're better now, thank you, doctor, I can move on with my life now, that is not, either it might not be sincere, or it is sincere but not grounded. So the person doesn't know what they're saying, or doesn't realize the weight of it. So if you recognize that, because from your perspective, it sounds like you're looking at body language, you're looking at patterns, you're looking at speech, you're paying very, very close attention to the person. So you know them on a very intimate level, on a very deep level. So I can assume that you can perfectly well realize that the conclusion that person came from might not be the correct conclusion. Yet you still have the mindset that you still think it's the right way to say, okay, you came to this conclusion, I respect that. So with that in mind, do your thing, and I'm here whenever you need me. It sounds like making that decision is a tough decision. Would you say that's fair, or would you say it's not the case?
If your rooted value is that you are a support, if you are the guide, if you are the person who is helping them reach their goals, if that is your genuine understanding of your role, that when there is a disconnect between what they say and what you see, you have kind of two options. One is, do we have the kind of relationship? Is this person in a position to take that challenge? Some clients are in a position to take that challenge. And you can say, there's a technique, it's called motivational interviewing. The underlying point of it is to take the person's values and then highlight how their behavior is not in line with those values. And you are holding up, elements of hypocrisy, or when they're not behaving in a way that makes sense with what they say they value, so that they can begin to correct that disconnect. Either they change their values or they change their behavior. That is how it works. And so if you are in a relationship where you are able to say, I hear that you think you're done, but I'm seeing these behaviors that aren't in line with what you tell me your goals are. Help me understand that disconnect. What does being done mean to you? That would be an appropriate challenge, because we hadn't gotten to the goal that we had agreed upon, or we have the kind of relationship where they're ready to take that kind of challenge. Other clients, this is a process of emotional development, and not everybody is ready to meet the goal that they said that they have. And they are not at a place that they are comfortable being so directly challenged. That's a judgment call. That is based on the conceptualization of how they are operating in the world and their patterns. And so you're right that it is a judgment call to be able to say, I'm so excited that you're so excited. That's amazing. I'm here when you feel like you want to come back, but I'm really excited that you've gotten to this place. That's a judgment call. And it really depends on, as always, you're going to get tired of me saying this, but is there a safety element? There's a safety element, and the person wants to leave. I have a responsibility to make sure that they stay safe. So if they're telling me they want to drop out and they have self-harm behaviors, or we don't have a plan in place, those are things that would keep you connected as much as possible. Outside of that, it really depends on who the person is, where they are in their own journey with themselves. I had a client, he was at the college counseling center. So imagine he's 21. He came to therapy for anxiety disorder, specifically some panic attacks, and he had some phobias. And so we were working on those. And he comes in one day and he says, I don't think you're doing a very good job. I don't feel better. And so I said, okay, well, let's have that conversation. Like, what did you expect this to be like? What do you need? And he got really angry and left and didn't continue. And so I went and talked to my supervisor about it and was like, well, I think that didn't go well. Um, Literally a year later, he finds my number. I'm not even at the college counseling center anymore. He calls me and he says, I'm actually ready now to have the conversation that you were trying to have. I got mad because you were pushing me. I felt you were pushing me to do something that I was uncomfortable with. I wanted you to tell me that I was doing a good job. And you kept saying, have you met your goals? And that's not what I wanted to hear. And came back. And that was now a different person because he'd had a year of experience. He had grown up a little bit. He had thought a lot about what our, kind of blow up was. I consider that part of the therapeutic journey. And that can't all happen in one chunk of time, that it is often going to be something that you do throughout your life, probably with different people. But he wouldn't have been ready for psychoanalysis.
Let's talk about women. Because I researched you a little bit before our conversation. And a lot of your work seems to focus around the idea of young women in their 20s or in their 30s needing a mentor to guide them through life, to guide them through the hardships that young women have. In your view, what are the pressures that young women these days are facing, like with their careers, with their body image, with their relationships, with societal challenges that they have? What are the challenges that women nowadays face? And how do you think they can find a proper mentor that can help them and that can guide them?
This is, I think, one of the things that has shown up for me as I've gotten older. And so now I'm in, sort of the midlife, and it's much easier to look back and recognize the ways in which I was not appropriately supported, particularly in career, but in general in relationships. I think women, though we are half of the population, are still considered somehow just men. So in being different, in being not main, we have to, I think, justify ourselves all the time. How is it that you are more emotional? Am I more emotional? How is it that you are interested in how people are feeling? How is it that you are still in this way that you are not operating as a man might operate? And, I had a very close relationship with my father, who did not understand that I would run into challenges in the workplace that he had never run into. So I remember the first time I got a corporate job, I was 23 and I had come out of college, and I didn't look very old. I have big cheeks and dimples and I'm blonde, and my boss would have been in his late 50s, early 60s. So I would have been sort of daughter age. And I remember we traveled a lot for that job. I was an auditor for insurance. We would repay claims to make sure that companies were not being overcharged or undercharged. That was my first job out of college. And so we would travel to these insurance companies to pull claims and work within their systems because it wasn't out on the web yet. And I remember my boss, I had a backpack from college that I was traveling with as my carry-on. And my boss said that I was embarrassing him because I looked like a college student and that I needed to do more to bring respect to the profession. And I remember calling my father and being like, so what am I supposed to do with this feedback? Like, I don't have a lot of money. Like, what am I supposed to do? And he's like, I think that he's just telling you that he's uncomfortable with you being young. Like, I don't think that there's much that you are actually able to do with the situation. And if I'd had someone on the team or someone who could intervene on my behalf, it would have changed absolutely everything about how I thought about that job, about how I thought about that boss. But I was in a vulnerable position where any judgment meant that I had to change. And that continued with each job that I had after. When they tell you radical transparency, what they mean is, I need you to take my feedback and change so that you make me comfortable. Every male boss I've ever had, and it's been all but one, um, has required that I show up in a specific way for them. I got feedback from a boss once. He was doing a 360, so he was talking with people who worked with me. And one of the people that he interviewed said, I don't like how professorial she is when she communicates to me. I don't like how I feel when she talks. I feel like she talks down to me. And so the feedback that I got from my boss was, you need to change how he feels when you talk to him. Now tell me any man who has had to travel this path so that what man has been given the feedback, aside from maybe being too aggressive, and even then, I'm iffy on whether or not they're going to be tamped down in given that kind of feedback. It will be more likely that I would be told to be less sensitive. It's this sort of navigating relationships where men are in charge and women are required to make men comfortable that I believe that women need to hear from other women about how they've navigated these situations, how to gain power without being penalized. It's very challenging to come alongside and not be penalized. Who to partner with, how to read the political tea leaves that you're operating in, when to leave an environment because you aren't going to be able to be successful there. And any more time that you put in there is going to be toxic and harmful to yourself. Those are all areas in which I think women are able to share experience, give appropriate advice, and hopefully slowly change what the dynamic is. And, you know, being a business owner, I would like to create an environment that does not have that level of power differential between men and women. I have a business partner who's male. I hire men and women. It's really important to me that we try to build a culture where it isn't that women are in traditional, you know, marketing and carrying relationships and men are in IT. Like, I would really like to make sure that we aren't following those kinds of stereotypes. But I think that women navigating on their own without support from other women are reinventing the wheel of dealing with the patriarchy. And we could do a better job of disseminating what we've learned and not holding water for the system that we've already worked through, and slowly making some change so that there is more literal equality. I don't
Yeah.
have no problem with, I love men, but the system harms men too. And so I feel like women supporting women to move through this world helps literally everybody.
Okay. Let me ask you a question, because I think you are drawing a line between acceptable responses and non-acceptable responses from people that have a higher position in the hierarchy within the company. What I would like to do is make that line specific, so I understand the pattern, not the pattern, that's the wrong word, but the framework on which you're operating. What I don't want to do is, I don't want to base this on things like equality and things like power differences or those kind of things. There's a lot more people that do a way better job at asking questions about that. That's something I don't think I can add much value in. What I am very interested in is that human aspect of it. So let me ask you the human question. Because when you laid out that 360 and the feedback that you got of being very professorial, I think it's a very hard word for me to pronounce, but that word. The first thing that came to yeah, pedantic. Yeah, thank you. That's a way. That's an easier word. What a memory that you instantly triggered for me is feedback that I got. And some of the feedback that I got, believe it or not, is that I'm very, very serious, right? And that I always look angry because my eyebrows are always very low, right? So I'm the guy that always got the feedback back in the day, like, hey, why are you always angry? You're always hyper serious. You have a deep voice. Also doesn't help with that, right? Is a combination of all of it, and everybody thinks you're hyper serious. That's just how it works. And you can do a couple of things with that. So now, for example, I can raise my eyebrows on purpose. Just to make sure I don't give it a stern look. But at the same time, I realize perfectly well that, just like what you were saying, there's an expectation on the receiving end, right? Because that person is giving me the feedback not with the idea of understanding, where that is coming from, which in the case of my eyebrows is literally just genetics, right? There's not much I can do about that except for forcing my eyebrows up. But instead wants me to change based on that feedback so they become more comfortable. And that strikes me as the exact same of what you just laid out. And I think there's a parallel between you and me, to be honest, because it sounds to me like you're a very analytical person. You're a very data-driven person. You like to understand statistics. You like to understand patterns. You like to understand what is going on so you can infer what needs to be done in order to solve this problem so we can move forward. You sound like that kind of person. So I can definitely identify with that as well. So I think that's beautiful. I think that's a very beautiful way, because that means you're very solution oriented, right? You're very practical. You can think very strategically. But the downside is people will give you the feedback that you're always very serious or that you're very pedantic. Back to your story. That is feedback that I also got. And I got it from both men and women. But you're specifically tying it to men giving it to you. So what I would like to zone into is what the message I think you're giving is there is a difference where men that are in leadership positions, they treat women a certain way, or they demand certain standards from women in order for themselves to be more comfortable. So two questions. What is the difference between your example and my example? So why, in this case, is that a man-female dynamic? And in my case, it would be a man-man dynamic or a female-man dynamic. And, okay, this is going to be a very blunt question. But is there not an underlying assumption in there that it is indeed a male-female dynamic? Why do you think that is? I hope it makes sense what I'm asking you.
Yeah, I think so. First of all, I think you and I both got judged on things that we don't have direct control over. So like, I wasn't given feedback about something that materially would help me do my job better, or it wasn't feedback about something that I could genuinely change. I have a doctorate. I'm going to speak the way I speak. I mean, that I would need to cater to this other person and their feelings for teamwork would in no way help the company. So the kind of feedback that you and I both got, where again, if you're getting feedback on things that you can't change in the next 5 minutes, 5 seconds, that's not actual useful feedback. So in both cases, I feel like we were getting information about ways in which people who are around us would like us to be different. That's not at all useful. And so I think corporate life is rife with that. The difference that I have experienced is that I will suffer very strong consequences to not demonstrating that I have taken that feedback seriously and that I have actively determined how to make that change. So the consequences to me of not making that coworker feel smart are that I will not get a good review and he will get promoted and I won't. A thing that literally happened. And some of the feedback was that I don't take feedback well.
Right. Okay.
So, um, so I feel like the male female is perhaps more reflective of power, but that the expectations of how I'm going to respond, even though the situations were quite similar, was that I have less room to maneuver and try, and I have to show up in a way that demonstrates that I have taken that feedback and I'm improving myself so that I am judged appropriately. Where I feel like if it were male to male, you could be given that feedback a couple of times. You could say, hey, I've been changing my facial expressions and I hope it's working. And that would be acceptable. And I think that is the difference there, where the circumstances legitimately are very similar.
Okay. One of the things I would do in that specific situation. So let me make it very personal. Let me just lay out how I would treat that situation, how I have treated that situation, because this was for me personally a learning path. If you take the Jeffrey from 15 years ago, that guy would get upset by this kind of feedback. He would get upset, he would get insulted, he would start feeling bad, resentment towards the person, right? There'll be something brewing over there that in the long term would not do anybody any favors. And that's not good. It's not necessarily destructive per se, that's making a bit too extreme, but it's not going to help the relationship. You know, you're not going to create this bridge between personalities, between two different people. So the way personally over time, and this took a lot of effort and a lot of learning, a lot of trial and error as well, and making a ton of mistakes. How I would treat that right now is I would try to understand why that person is bringing that forward, what is underneath it. I'll put a negotiation cap on pretty much, right? So what makes that person give me that feedback? That's, I think, a very good starting question. Because if we are, for example, dealing with... Let me think of an example, because there has been a situation in the past where I was working together with someone who was higher up in the hierarchy. And this person had a board level position. And I was operating directly under, not necessarily under him, but on the hierarchy speaking, I was one level below him. And that person was very impulsive, very quick to blame others, very taking credit for the work of others. That is not good. That is not good to work with if you don't treat it well, I think. So 15 years ago, I would have been very upset by that. You know, I would have threatened to leave the company, or, I don't know, pick the fight with him directly and then blow everything up, you know, in a conversational sense, of course. That would not be good. Right now, I would ask myself more the question, or I would even ask him the question, something along the lines of, it seems that there's something going on that you feel very strongly about, and that is preventing us from working together optimally. Is that something is it reasonable, or would it be reasonable to bring that forward? So you and I, we can find a way to bridge whatever it is between us, so we can both be very happy with what's to come. You know, something along those lines. So make it, what I'm trying to do is I'm trying to connect with the person I'm talking to. It doesn't matter who they are. It doesn't matter if they're emotionally unstable. It doesn't matter if they're hyper dominant. It doesn't matter if they're people pleasers. It doesn't matter if they're analysts. It doesn't matter what kind of person it is. And every person has their own way of dealing with them. But by connecting with them, by being empathetic, you allow yourself to connect with that person and therefore see what is needed to work together with that person instead of blowing the entire situation up. But now once again back to your story, because I would like to bring these two things together and I would like to find where the truth is. Let me give a different example and let me know, this might sound very unfair, but let me know what you think about this. If someone has a mindset that they're being victimized, it makes them more likely to see patterns that confirm that. And then if that is being used as an excuse to not have empathy and to not connect with the person, then you could jump to all kinds of conclusions that may or may not be fair, because no connection has happened. So this is not a projection. This is not me talking about your specific situation, but this is me thinking out loud. This is me trying to evaluate your specific situation, your example. When you hear this and you think about that specific example that you just gave me, how would you link these two together?
I hear a couple of things as you're talking. One about sort of the level of confidence that you gained in your own abilities over time. So the Jeffrey of 15 years ago was more insecure. And so when you would get that feedback and it hurt, the emotional experience of that was to feel the need to defend yourself because the level of confidence wasn't as high. Very common, especially early on in our careers, we are still trying to make our positions and we don't feel as safe. And so what I heard in that early bit was I'm operating in an environment where I don't feel as safe and I don't feel as secure. 15 years forward, you're now in a position where you feel that you have the confidence and the ability to take feedback and do something with it that is more constructive, and that you have the confidence to be able to go to another person and try to elicit that kind of change. So there's a certain expression of emotional content power where you say, I think that there's something going on with this person. I can, because I have the ego strength, I can confront them about it, and that's not going to endanger me. I'm actually going to make things better for both of us by being the person who brings this forward and saying, I think that there is a challenge. So certainly in crucial conversations and some of the other kind of workplace education that they offer, that is the advice that is given. It is take the feedback, recognize the way in which you might be able to show up differently, and then work with the other person on where the problem might lie. That requires a certain level of psychological safety and physical safety. So those are requirements for that kind of behavior. If you have those two things in place, then yes, you can absolutely do the kinds of behaviors that come from having a solid foundation to stand on. I can go and have that kind of conversation. And if the insecure person who blames other people and is behaving in an erratic manner is not, doesn't take that kind of confrontation well, I'm still okay because I have confidence that my manager has my back, or that, I'm not going to get slandered on, the social media or whatever the potential consequences are, that I have the ability to have that conversation and that other person is willing to negotiate with me. So those are all assumptions that are made in the, is this not a thing that you could do with that kind of feedback? It absolutely is, so long as there are certain foundational elements in place that enable that, that even in your own experience earlier on, you didn't have. And so you reacted in an emotional way,
Right.
not because you necessarily were insecure because you're not capable or even strong, but because you weren't appropriately safe in the environment that you were in. So in my case, being able to go to the man who had given me the feedback about feeling that I talked down to him would mean that it would be a conversation about, how do I earn your respect? How do I make you feel better? Um, and it may or may not be something that could be resolved. It could absolutely be that I see myself as a victim and therefore I see the other patterns of the ways in which I'm being victimized. It could also genuinely be that this person recognizes that the way to gain power is to push me down.
Hmm.
That is a legitimate strategy that people do use in political environments. And so I could take it as a direct, genuine piece of feedback, or I could look at the way he operates with lots of people to understand the way in which he is gaining power and recognize that, and maybe this wasn't actually in anyone's best interest that I engage with this feedback, because I may just be giving him uh, more opportunity to push me further down. And so I think that there's an evaluation there of safety that men don't, I think, have to more immediately do than women do. Um, it is perhaps a reflection of a victim mentality, but my experience tells me that it is not that I view myself as somehow inherently more unsafe because I am a victim. It's because I am viewed as easier prey. And that is the fact of the matter is that I have fewer external support systems that are evidence in a work environment. I
Hmm.
am just less powerful in that regard. I don't have as many advocates. And so when you have an advocate or you have multiples and they have power, this stuff doesn't happen as often. So you'll definitely run into women for whom they don't have these stories. They're operating in environments where they are psychologically safe. And then they do this kind of, they behave like men. Not because we're so different, but because we often are operating with less safety.
Hmm.
Just structural
Hmm.
safety, sometimes physical safety too. I can't tell you the number of sexual situations that I've had to handle, that I don't think that you probably have had to handle in a work environment. That we just I just have to show up every day after that and assume that things are going to be fine. But I believe that we have to examine the level of literal psychological, physical safety before we can say whether somebody has a victim mindset.
All I can think about right now is that from a man's perspective, this is a very hard discussion to have because it's very easy to say, hey, just ask the right questions, and hey, confront him, and hey, don't agree with don't be too agreeable with the person, and stand up for yourself, and all these sorts of things, right? But then if I would say that, I will be projecting my own experience onto other people.
I had this conversation with my husband because he used
Hmm.
to ask me when I traveled why I didn't go have dinner by myself, like at a restaurant by myself, or go down to the hotel bar by myself. And he was like, "Why are you so shy? Just go down and have a meal. Like, you don't just stay in your room." And I took that feedback literally and said, "I guess I'm just an introvert and I need to get out more and I need to be braver."
Hmm.
And so I did. I put myself out there. I sat at the restaurant by myself. I went down to the hotel bar. Do you think I ever got to sit by myself? Do you think that I got to just eat my dinner and, look at the sports on the TV? Or do you think that every single time I went out by myself, that I was open game for conversation, for someone to sit next to me, for somebody to talk to me? There was no, his experience and mine
Yeah.
were radically different. And he was doing exactly that. He was simply saying, you'll have the same experience out in the world that I do. And if you don't, just don't talk to them.
Yeah. No, but this is what makes it so hard. Literally, what you're just saying happened this morning. My wife went out. She went for shopping, and she was bothered by just a guy, who was just looking in a very obnoxious way at her, and it made her feel uncomfortable. Obviously, that has never happened to me. And if a woman looks at me like that, okay, fine, I don't care. Look whatever you want. So I realize that 100% that dynamic is very different, and this is what I think makes it so hard, because for me, from a man's perspective, again, I understand that there's differences in experience, and I understand that there's difference in behavior, and I understand that there are situations where there are men in positions of leadership and that are either taking advantage of or pushing down or doing whatever it is that they can to make the life of the women under them miserable, or not even necessarily under them, but around them within that same company. I 100% realize that. And what makes this so difficult is that I think that there is and this is a personal feeling that I'm having. I think that the story that you're telling, and the story that my wife told this morning, and the story that countless of other women are telling about what they're experiencing outside on the street or in their workplace or even in their own families, even in their own, four walls. There is obviously merit to that. That is obviously happening. And that's obviously something that is not good, and that needs attention. But at the same time, you have this story that automatically goes to victimization whenever there is feedback. And this is not what you're saying. I'm not putting words in your mouth. This is just my personal feeling about this whole situation. There is women that will pull a victimization card just for the sake of it. And let me give you a very good example, an example that was very painful to me personally, because you said earlier, I think you have never been the receiver of
Harassment, advances, assault.
right. And you're right. That has never happened to me. But what has happened is a rumor was being spread about sexual misconduct. And I can guarantee you that rumor was very, very false. And this is something that men have to deal with. So let's use the word pathology again, because the pathological version of this entire thing is that it might be weaponized. There are situations where women go out of their way to spread a rumor about being victimized or being of events is happening, right? Of a sexual nature within the workforce. And that is not the case. And that is, well, I can't even put words on how destructive that is to the reputation of a man. And luckily in my personal case, that rumor was spread and it was killed really quickly, right? So it didn't go further. It didn't have consequences for me because everybody around me realized, no way, right? We know this girl, this is not true, right? So there was already a reputation there that protected me. But it might very well have damaging implications. And this is what I'm trying to figure out, right? Because there is a very fine balance. What is actual misconduct and should be recognized, especially by men? And what goes the other way? When is the victim card being pulled and even abused? And that makes this whole discussion so hard. Because how do you recognize what you're dealing with?
So for most of us, we're following the same rules. You and I probably operate at work quite similarly, and I'm doing what I can to show up in an ethical manner, follow the data, and that you can learn to trust that my motives are such that I am here because I want to do a good job and I want to contribute, right? And you can trust that, and that regardless of our gender, we're going to show up similarly because we have similar values. But there remains, because of the patriarchy and the way that power is not evenly distributed, and that I don't have the same level of physical and psychological safety that you have by nature of the situation that we work in, that more men have more power in a workplace by hierarchy, by just the fact that you're more likely to be believed in certain circumstances than I am, that some women will take that differential in power and attempt to weaponize it. That is true. They will take what they perceive as the power that they have, which is to somehow take the victimization and turn it on its head, to use it to harm men. And it is a weaponization of a power differential turned over. And so we don't necessarily solve that by not believing that there's a power differential. We do that by changing the power differential. So you don't weaponize when there isn't the need to have power, that you're figuring out a malignant way to do that. You are able to have power because there's a legitimate path for you within the society to have that power. And if you resolve the lack of psychological and physical safety challenge, you don't need the same level of power over men because you don't have the differential and the fear. And so I hate when women use this path to gain power. It harms everyone, men and women, and it only makes the likelihood of not being believed when things do happen more likely. But I recognize that when you feel that you have few options to gain power, that some women feel that it is the route that they have been given. This is a very inexact analogy, so take this just as an example.
Mm-hmm.
But I recall distinctly there was a Black family that lived in my neighborhood and often walked in the middle of the street, just walked down the street in the middle of the street. And I recall my mother getting really frustrated because you're driving and you can't turn into your driveway or whatever until this family has moved down the middle of the road. And I remember in graduate school bringing this up to one of my professors and having them say, how are they getting their power? They got power by walking in the middle of the road and inconveniencing you, and you were frustrated. And if they'd been on the side of the road and they'd been on the sidewalk or whatever, you wouldn't have noticed them. There wouldn't have been a problem, and you would not have this conversation with me. So how are they getting their power?
Mm-hmm.
And so it's not to say that they were right to walk in the middle of the road or that was an adaptive, healthy way to get power. But it absolutely was an expression of the fact that they didn't feel, and in fact are not, at the same level of power that I have in our society. And so that one instance of, I mean, it happened all the time, but that one example where they were doing a thing that I saw as super destructive to them and to us, but was an expression of how you can get power in a system where you don't have it directly. And I feel like this is the sort of thing that this person was doing to you, possibly because they're sociopathic, but also because they might not have felt that they had a legitimate way of pursuing power in the organization. They weren't going to get promoted. They weren't going to move forward in their careers. And so they're going to make drama and to feel like they're more powerful than they actually are by going sideways and weaponizing the inequality that we have.
And to be clear, when you're using the word power, you're not necessarily referring to the place in a hierarchy within the organization. you're speaking more of it in a broad sense. So the way that a person can go through life in general.
Yeah, maybe agency. Agency might be another word, or effectiveness.
Would competence be a word?
Possibly, although competence is often something that someone else's judges you on. Whether they feel that you have confidence, you may have confidence, but your behavior is usually judged by others to determine how competent you are. But yes, I would agree that power is a big word here, and that there are elements here where I'm speaking about uh, how effective I am at moving through the world, or um, um, how much further I am able to go than where I currently am. And that may be just in my own sense of worth. But often it is that I have a path forward where I'm getting additional resources, whether they're psychological, emotional, or monetary.
From your experience, is there research that's pointing out that men are uncomfortable with women in higher positions than them?
Yes.
In the workforce specifically, does
Yes.
it exist?
Yes. Yes. Yes.
Why do you think that is?
A couple of reasons. If women have been in positions of power in men's lives, then they are, and by power, I mean teachers, effective mothers, nurses, doctors, and they have lived and grown up with women in positions that are considered to be sort of equal to men. They are much less likely to be uncomfortable with having a woman as a boss. If men have grown up and only seen men in institutional positions of power, then when a woman is the anomaly, they feel very uncomfortable because they don't understand the way in which this person, this woman, has subverted the system of unnatural
Right.
men in leadership. So I would say, we've moved in a position, more even so in Europe than in the US, where it is much more visibly likely that you will have a woman as a boss. But I remember just talking with my father in the 70s and 80s, when he was in the corporate world, having his first female boss and having all kinds of psychological challenges because the way that he was raised. My family's from the South in the United States, and that particular culture is one where men are supposed to take care of women. And so his training from childhood was that he needed to take care of this woman, but this woman is giving him orders. So he had to think about this person without a mental model, without a schema that made sense. He had to sort of cobble together what is my role in my relationship with you? Am I supposed to treat you like a man? How am I supposed to speak to you? So if men have had experiences where they have built that schema in their mind about how to relate to women who have more, institutional power than they do, then they are much more comfortable. But if that is a first experience, or one where that woman is doing something in an environment that is traditionally surrounded by men, men feel deeply uncomfortable because they do not understand what the type of relationship is, what language is acceptable, and all their back training about how they're supposed to behave and understand the relationship to that woman is turned on its head. And so the literature is clear that the more examples we give of women in power, the more likely we are to have men who are comfortable with women in power. And the more that we enable it, and
Right.
from a young age, when you ask a child to draw a picture of a doctor and they draw a woman, that change has occurred only in the last 20 years, where there are enough represented women, especially in pediatrics, that's the association that children have.
Yeah, so this is a problem. This is a problem that by itself, if I'm hearing you correctly, will solve itself over time as we are moving. It seems at least that we are moving in a direction where, well, honestly, I don't know it any different. If I look at my own, so if I just don't look at the data for a second, if I look at my own personal experience, there have been, except for one, always been women in either board level positions or one layer under that, so the high manager position, let's say. Right now, also where I'm working right now, the exact same story. Right, I'm working together on a project right now with a CEO of one of our subsidiaries. Right now, amazing, amazing collaboration. And I never found that I never found it awkward, to be honest. I don't think so, at least. And I think that's because of a situation where that has been always the case. Let me give you another example. To be honest, put a stripe under that. One of the things I found really helpful, and this also ties into that mentorship question that we just discussed about women, about young women in the 20s and in the 30s. One of the things I've realized, maybe, let's say 3-4 years ago, something like that, is the importance of a good mentor. I think I was 29, so I think 5 years ago, of the importance of a good mentor. And my first mentor was a man for around a little bit over a year. But right now, it's a woman. And that, to me, she is a amazing soundboard, right? Not just to think through very complex ideas that she has way more understanding of than I do, because, why think about everything yourself, right? When you have people that know way more about a specific subject, it only makes sense to ask them for their knowledge. It's a privilege to be able to do that, which is why I love these conversations so much, for example, with you. But it's also very refreshing, right? Because there is a very different perspective that you get on things. I don't find that intimidating. I find that refreshing, to be honest. And for me personally, I don't have a preference for one or the other, right? They both serve a purpose. I can look at it very technically. Like, okay, if I have a man mentor, a male mentor, for example, in my job or outside, and he has a certain background, I know what kind of personality he has. I know what kind of job he has. I know what kind of expertise he has. So I know what kind of information and wisdom I can leverage in order to make whatever improvements I can make in my own situation, right? And the same goes for women, right? They have their own experiences, and it's very helpful. Okay, I'm kind of repeating the same point, but this is why I love having this conversation so much with you, because again, the balance, striking the balance between what are the real issues and what is the weaponization of so-called issues, that is a hard balance. And that is a hard that balance is impossible to find if you don't engage with in this case the other gender, but it goes for any topic, right? Because if you're talking about, you can pretty much go about this from a race perspective, from a gender perspective, from an ideology perspective, from a political perspective. This goes for everything. The moment we don't talk to the other side, whatever side that is, if we even decide to be on a side, right, you don't learn. You are stuck.
We don't engage when we are scared, and scared can look lots of ways. It can be afraid of the other person bringing up points that we don't know how to defend. It can be that we're afraid of feelings that we don't want to feel. And so when we talk to someone who challenges us and they bring up something and we don't want to feel that way, so we don't want to engage with them. I feel like the best boss I ever had, male, I've only actually had male bosses. I think partially because I've been in product. If I'd been in marketing, I probably, or HR, or the places where women, at least in the US, tend to be more present. He was a very secure man. So I could not ruffle him or challenge him in a way that would break the alliance. So he made it extremely clear that he had my back and that I'll give you an example. I was starting off a customer research program for him, and I was I made a mistake with an email send that I did, where I had a missed line in my spreadsheet where the email name was for the person below them. So
Mm-hmm.
I shut it down and, sent my mea culpa, and it ended up being fine. But I went to him and said, I'm so sorry I made this mistake. And I was waiting to be, you know, essentially had to go through the process of sort of justifying myself and why I did this and how I would make sure it never happened again and those things. And his response to me was, I don't think that task is the best use of your skills. I think what you need is an assistant who takes care of those things for you, because what I need you to do is be working at the strategic level about building this program, not figuring out how spreadsheet details work, because it's not a great use of your time. I've never felt so seen. And then it wasn't even that he had resources to give me. He could have easily come up with another way of doing it. It was by seeing that he could better use me than I even understood at the time. It gave me such confidence. And that any other mistake that we made, I was so willing to go and talk to him about it and then figure out. And so we were partners in a way, even though he absolutely had, institutional power. But his security meant that my mistake did not, in his way, did not reflect on him. The way in which he assumed it was that he had done something that didn't enable the best work for me. I can tell you how very rare that kind of boss is, and that the fact that I have tried to emulate him as a boss every time, for every team that I've had since, because of the way in which I felt such loyalty to him and the way in which I felt so motivated to move this program forward because of the way he responded. Not that it was his gender, it was that he was secure, and it was not a reflection on him that I had made a mistake.
Mm.
That security, you will continue to hear that as a theme for me, because ego strength is the thing that I think pulls people apart in whether
Mm-hmm.
or not they are good at managing other people, being good parents, being good partners. The more secure you are in your ability to handle whatever comes up, your emotions, somebody else's emotions, means that you can engage in those deep conversations. If I'm going to talk to somebody on the other side of the political panel, I need to be secure in my own beliefs. I need to be confident that I have values that I can espouse and that I'm consistent, so that when they challenge me, I am capable of saying, I hear what you're saying, but that goes against my basic values. I believe in equity, and equity looks like this. And when you say that this is a policy that you believe in, it violates my sense of value of equity, I need to be able to feel confident that I can do that. Otherwise, I just feel like I've got hot air on my face, and I get hot, and I don't know how to engage, because I'm not confident enough to be able to have that kind of depth of conversation. I think it is very rare for people to get to that level of psychological security that they can engage almost anyone in those kinds of conversations, and to find mentors who can model that. And be able to say, it's not that I expect that you can have this conversation today. It's that I want you to get to a place where you're confident enough in yourself that you can have this conversation.
There are so many things coming to mind right now that I want to tie into. There are so many questions that are popping forward. Like, okay, how does one go about finding a mentor? But don't answer that one. Let's keep that one for another time. But one thing that you said about your old boss absolutely resonated with me, and actually it brought an idea forward, because you said you've never felt so seen because he had a vision for you that was bigger than the one that you had for yourself. This reminds me of a absolutely genius quote that I've heard, I believe, in Modern Wisdom a couple of weeks ago, and this was about relationships. The question there was how to find the proper partner. And the answer to that question was, you know that you have the right partner if your partner has a bigger vision for you than you have for yourself. And maybe, because that quote, genius, absolutely genius. But I kept it at that, right? So in the relational sphere. And right now you made me realize it's not about the relational sphere at all. It's not about your partner at all. Maybe that goes for everybody. Maybe that goes for your friends. Maybe that goes for the people that you work with. If their vision for you is bigger than the one you have for yourself, those are amazing people to have around you.
Yes, I couldn't agree more. I think I know my limits. It's one of the benefits of age, but it's also one of the things that keeps me from growing and envisioning things that I could do beyond what I think I can do. And so to have someone else have confidence in you and be able to articulate the way in which they sort of see how you can show up in the world bigger, better, uh, and really genuinely believing you in that way, I think it's an unreal feeling. My business partner recently was talking about how, his vision for our company and based on what I've started, is a million sessions a day. He's like, I want it to be international. I want a million sessions a day. And I don't see any reason that we can't do that. Fantastic. I want that too. But would I have articulated that from my own? Probably not. No. And so that is where that sort of I can rest on his confidence in me and in us and in this idea. And then I can enact that vision using my strengths. And I think that was really the point of having a boss who was saying, you're built for more and I'm going to get you help.
Alison, there is honestly 1,000 more questions I could ask you. And we spoke a little bit before this conversation started. And I told you, if 50% of the questions that I've prepared in advance for you get thrown out the window, so be it, right? It's an organic conversation. You never know where it goes. I can guarantee you it's way more than 50%. I think around 80 or 85% of all the questions went out the window. But that's okay. That just speaks to the insanely interesting conversation that we've just had and to the interesting personality that you have, the wisdom that you have, the experience that you have, and all the different examples that you brought forward just to make clear what you're thinking about them. And you answered a couple of very big questions for me that I've been asking myself for a long time. For example, about that autism thing, why it was consolidated in DSM-5. Now that we've talked, it makes perfect sense. But the last couple of years didn't make any sense at all. And that's just the power of wonderful conversation. And that is exactly the reason why I think it's really, really beautiful to speak with people that know more about something or think in a different way about something than you do, because that is where growth happens. So with all of that said, is there a question that I didn't ask you, but that you wish I would have?
I think we hit on it a little bit with the sort of pathologizing our regular human experience. But the one point that I wanted to make is how important sort of cultural scripts are in how we understand our own emotions and what's allowable. So I'll give you an example. We have a script about kind of going to school, going to college or getting a job, working your job, starting a family, and then maybe working and retiring. And then the script falls off. The script falls off and we still have 40 more years of life. And there's nothing in the script about what happens when people pass away in this life script. And we just and what happens if you don't want the family or you don't go to college, or what happens when you don't fit the script? And what I think is true is that we are not prepared for what life gives us, because our culture likes to ignore anything that isn't conveniently related to the particular script that I'm not even sure why it's as universal as it is, at least in the class and countries that I've lived in, that I think people are operating very much feeling unmoored because we have been given this idea that we're supposed to know what to do because society gave us the script. And it's wrong and it's thin. And I really feel like if we could question the script earlier in our lives, if we were able to not feel like our families were pushing us in the direction of that, standard beats of the music of our lives, that we would get used to asking these questions about what happens to us and what we need and how other people can help us much earlier in our lives, because we all confront this at certain times. I don't know what I need. I don't know how to ask for help. I don't know why this thing is happening. I don't know how to react to this. And that often is the time that people feel the need for support, is when those kinds of questions of I don't know, and our society simply does not give you the answers. The only other people who can give you the answers are people you're in relationship with. And if we were not going to pathologize not knowing or having life events that go against the cultural script, I think a lot of people would feel more comfortable in living their life and experiencing what happens without having to judge it against whether or not it's okay or normal, because the okay and normal are so thin and so not applicable to so many people and circumstances. And so these life transitions that I talk about and how people react to them, the layer that I feel like is important to highlight is the sort of cultural piece, that if we did a better job, people would be better prepared. And absent that, we need to do a better job of connecting people to each other when they don't know, or when they feel like whatever is happening shouldn't be happening based on whatever external or internal judgment they've determined. So that was the piece that I wanted to make sure that I highlighted, that I think plays into why life events get pathologized.
Alison, thank you very much.
Thank you, Jeffrey. I've really appreciated it. This has been a lovely afternoon.
Thank you very much. Take care of yourself.
Thank you.